Hello, everyone. First of all, thank you for uh, reach out to me and trying to send me the questions about the healthcare in Thailand. Okay, first of all, let me introduce myself. By the way, I got the questions in total 15 questions, but some of them can be together, so I'm not gonna uh, answer every question list that you send it to me, but I will try to combine things, some of them together. My name is Pintong Lekan, and people call me K as my nickname. So I am living in Thailand, and I was born here, and I was uh, studying abroad for a while, and then came back to Thailand and working with the NGO organizations in my hometown, in my regions, since I got back from the US. Basically, what I'm doing now, for my for my job, like working for a living, I do the translation and interpretation for international research project or journalists who come to Thailand. And a part of that, I am women rights activist. So I am now doing the project called Women Movement Against the Dictatorship in Thailand. So I'm a member of the movement, and in my region I kind of like running a program against racism from not racism, let's say discrimination from people from Bangkok, from the central region, toward against people in my regions, especially women. Okay, roughly for my introduction. I will go right to the question. Talking about my personal maintaining my health. So basically, I like to use herbal medicines for myself, and food and exercise. I'm pretty much concerning about what I eat, and what I put in my food. I cook for myself, not often that going out to eat outside, because I aware of how people cook. And as you may know, in Thailand people use a lot of MSG, monosodium glutamate, in their food, so I don't like that. I cook for myself most of the time, and I do exercise. I do yoga. I do sometimes cardio, but not really crazy exercise person. I just doing like stretching or yoga nidra for my sleeping. I I will use the modern medication if I need it, but not every single time that I get sick or headache, some pain. I use my first aid, treating myself at home. For Thai people, the same question you're asking about culture awareness and belief in healthcare practice in Thailand. I think healthy and organic food is a trend for Thai people, especially middle class and upper classes. But for local people or for like working lower income class, whatever they can have in that table, that's it, you know. Because I must say organic food or healthy foods in Thailand is pretty expensive. So people who can afford that is gonna be like working class, middle class or upper class. That's it, the trend in Thailand right now. The example of culture or belief in health practice in Thailand, or you asking about the characteristic of population health behavior. I think in Thailand, some of the illness or health issues for local people, I would say they're still considering the traditional healing, like using the herbal medicine, or sometimes people go to talk to the spiritual person in their village or nearby, kind of like spiritual healing. But in general, that we have like a local hospital, like a public hospital, but in a local scale. So we can go to talk, we can go to get a treatment, but for some kind of like an accident or injure, most of the time people go to the hospital. Number 5, the habit of Thai people to maintain their health. I think we are like other countries, modern countries. People eat junk food, and if you may know Thai central food, drinks, and dessert, it's pretty sweet, sweet and milky. Thai people, central people, using coconut milk in their cooking. For my region, I live in the northeast. My food culture, we're not using coconut milk, we're not adding sugar, so it's pretty different. But for now, if foreign country know about Thai food, mostly they know about Thai central food. That means they are adding sugar and coconut milk. So the number one sickness in Thailand, I would say cancer and diabetes, because of the food culture changed, and because of the agriculture that farmers using the chemical fertilizer and pesticide, so that's also another factor of health issues for people, because farmer using the chemical fertilizer, it harms their health. But also not only the farmer health have a problem, also the consumer or people in general who buy the agricultural product from the farmer who using the chemical fertilizer also get the impact from that kind of chemical as well. So I would say cancer and diabetes is the big problem for Thai people so far as I heard. Number 6, Thai people respond to the pain process. Do you go straight to the hospital? As I said before, it depends on how serious of the pain. If it's common pain, like a headache, body pain, normally people can take care of themselves at home. We can buy the painkiller at the local drugstore. That's the first thing that people do. But if pain doesn't go away, if even getting more serious, yeah, we go to the hospital. I'm not sure for the number 7 question. Do Thai people still believe that disease process is transmitted by other like voodoo? If it comes from Europe, I believe that the disease process is caused by past sins or even evil spirits. Okay, I'm not really sure if I understand correctly, but I will just say something about this. Uh, let's give the example about coronavirus, COVID-19, the pandemic. Thai people know that's the virus, even it comes from China or maybe the US, but we know that it's nothing connected to the voodoo thing or black magic or evil spirits or sins. I I haven't heard about this so far, so I think Thai people knows that this is the virus, something like that. You know, for the number 7, I'm not sure if I can cover this question. Number 8, you are talking about cultural mandates that existed in 1940s, especially mandates number 11 and number 12. For the number 11, I don't see this as the obligation for people to do it. Like, Thai people should eat and 3 times a day, 4 times a day, something like that. I don't see that because now lifestyles change. You know, some people work at night, some people work during the day, so they have like a different time of lunch break or dinner. So we cannot follow the mandate number 7 no more. You know, but maybe some people doing that, but it's still not obligation to do it. You know, but for the number 12 about respect elderly, I think it's not like a obligation for Thai people to do that, but it's about, you know, being nice to people, to children, to elderly, to disability people, being nice to them, helping them if they need help, just that. And yeah, Thai people doing that, you know, and respect to the elderly. Yes, I still seeing that, but we see some slight change right now. If you follow the political situation in Thailand and protests yesterday and the day before, and you know, still going on right now, like the student and young people become a leader of the protest, and then some of the request or the issue that they raise in the protest is about, you know, new generation can do something more, and the older generation maybe you do wrong, so you need to step out. They mention to the government or the prime minister. So if you know, some kind of conservative people, they will say like, oh, this is not nice, you know, you are young, you should respect elderly. But when you know, talk back to the older people saying like, you're doing something wrong, you need to step out, that's unacceptable for conservative. But for, you know, new generation, for like a younger people, they think this is fine, normal, you know. I think something changed right now. Number 9, how do Thai people view nurses? Like, you mean Thai people see nurses or medical professional? I think so. For local people, I think the nurse is a it's still like a noble profession. People respect them. People maybe, afraid of them, afraid to ask question. But for middle class or upper class, nurse just a job. Especially if you work for the private hospital, you will need to, listen to your customer, not patient. They were considering like people who, you know, using your service as the customer, and you need to treat them your best, something like that. Not like you're special or you're like you know God. No, you just do your job. Number 10, government health insurance. I think in Thailand pretty much everyone can use this health insurance very easily, just showing your ID card, national ID card, so you can just like very easily to check if you fall into the government health insurance or use social security insurance, because for the we call like universal health care scheme, for like a regular people who not using the social security insurance, that means everyone else, for people in general, we just showing our ID card is easy. But if you work for the government, you will get a different insurance from government. If you work for a company, factories, you will fall into the social security health insurance scheme. It's pretty easy. But this means for Thai citizen, if you're like a foreigner, you need to have your own health insurance. If you're like a migrant worker, you need to, I don't know, maybe the your employer need to provide it for you. But if you're illegal working in Thailand, of course not, you cannot access to that. You need to pay for yourself. Illegal. Number 11, abortion. What about the practice of abortion? Abortion in Thailand has two types, at least. So if woman who wants to get abortion, regarding to her health, or she get raped, yes, you can get like a legal abortion. But if you just get pregnant and then you don't want to have a baby, you will go to the hospital and say you want to go to the hospital and say like you want to get abortion. No, that's not allowed. That's prohibited. That's against the law. So I would say abortion still illegal in Thailand. And now in the political protest, many women, LGBT groups, they also include the legal abortion in their package to request to the government to, rewrite or fix the law. Number 12, gender equality, LGBT. I would say gender equality in Thailand is okay, but still need to be improved in some point. But for LGBT issues, same-sex marriage is not legal, but same-sex relationship looks fine for Thai people. But as I say, like still not having the law to support same-sex marriage. But as again, I said in the political rally right now, LGBT and women groups, they are, doing like the law advocacy on this issue. So because I'm one of them, we want to have legal abortion for every woman who wants to get abortion. She can do it legal and safe for them. Number 13, Thai people's habits of life. You mean lifestyle, hygiene, or cleanliness? Okay. Oh, okay. I think in general, Thailand is a clean country. It's clean country, but not compared to Singapore, of course. Thailand still not be able to compete and compare to Singapore. But I would say, well, it still depends on where you go. If you go to, nice places, for restaurant, for maybe hotel, yeah, you get pretty good and clean and hygiene. But if you go to slum, of course, everywhere, it's gonna be like not that clean. And somewhere in the remote area, maybe not that clean. And it still depends on like how you identify the clean in your definition. Number 14, how do Thai women maintain their beauty and health? Okay, beauty care and plastic surgery. I am not sure how to answer this. Many friends of mine, they're doing plastic surgery, but many just don't care. So I don't know how to answer this. I think it depends on how much money you want to spend on the beauty things that you want, or how fast that you want. Because if you have enough money and you want to get slim, you want to get like a very skinny, nice, slender body shape, you can pay for surgery and you can get very nice body in like 10 days or 2 weeks. It depends. But remember I said from the beginning, like the healthy lifestyle is a trend for middle class people in Thailand right now. Many women, they go to exercise. I mean, at least they're trying to dress up to go to the gym. Like they have nice yoga pants, nice swimming suit, something like that. Because at least they want to get healthy. This is the trend. And yeah, it's depend on each person. You have money, you want to get things done fast, you just pay for the doctor to cut out your fat or reshape your face. But if you don't care about that, you just go to exercise, get your health being healthy, your life being healthy. That's it. Number 15, do children in Thailand get immunized? I think so. Yeah, I don't have children, so I don't know that exactly. But I heard that people get their children, their babies, to get vaccine. How does the government regulate health program for children and elderly? Yeah, as I said, I don't know. I only know that children and elderly get free treatment for like a common illness. I'm not sure for other issues. So, oh yeah, this we're talking about the public hospital, not the private one. Some of the parents, they want to get the best for their children. pay for the private doctor to, you know, get the vaccine for their children. Okay, 15. I hope this answer your questions and cover whatever you are looking for, and good luck, and thank you for again reaching out to me, and you know, get a good grade. Thank you. Bye bye.